Welcome back, folks. Another topic today, what I did to match diagnostic radiology as a reapplicant, how I pivoted after not matching into orthopedic surgery and finding this out, of course, in March, at the end of fourth year of med school, what I did kind of to use the remaining few months of med school that I had left, and then what I did early on in intern year to get me to match radiology. So first thing I did was when I found out that I didn't match to orthopedic surgery, I talked to my school. I rallied my school, and I rallied those who I thought could help me. The thing about this is you never know who's going to help you, so you really have to reach out broadly and then, run with whoever gives you support. So I talked to my school about delaying my graduation by a year. They said no, so I ended up delaying it by 1 month. And I think, that was ideal for me. In that time, I had one rotation left, which was, it had to be either ICU or emergency medicine. So I reached out to some radiologists and I said, which one is better if I want exposure to radiology? They said emergency medicine. So I was able to switch that rotation with my school, make it emergency medicine. And then I rotated in radiology for 2 weeks. And I also rotated anesthesia for 2 weeks because I wasn't sure what I wanted. Later on, I developed a more sincere passion for radiology, and I'll talk about that later. But, initially, if you don't match, you can't just bank on one specialty. You have to kind of have plan B, plan C, plan D, et cetera, et cetera. At least that's what I believe. So once I switched to emergency medicine for my rotation, I basically put myself in a position where the whole rotation is like around radiology. So obviously it was in the ED, but I had the opportunity to talk to radiologists on the job. I talked to radiology residents. I visited the reading room, and I let my coordinator know, hey, I choked in the match. I need your help. I need shifts that are not during Monday through Friday, 8 to 5, because I want to go shadow radiologist then. Can I do night shifts? Can I do weekends? And they worked with me. So you have to reach out. You have to rally those around you. You can't do this on your own, especially if you're a reapplicant. You cannot do this on your own. So that gave me some good exposure to radiology. And then I hit the floor running when I did my 2-week radiology rotation, because I was already basically going at least once a week or twice a week even to hang out with the radiologist outside of my rotation in emergency medicine. So the next thing I did that I want to talk about is I basically developed broad connections with every specialty that I had even the slightest interest in. One, because maybe it'll help me if I don't match into radiology, but the other thing is these people also helped me to just get connected. They knew my story. They knew this was someone who was reapplying, and they just kind of helped move my story along, or my name. They passed my name on to their coworkers, their colleagues, their co-attendings, etc. One thing I was lucky in that I did, in that, you're applying to, when I was applying to orthopedic surgery, already by definition, you have kind of an interest in MSK imaging. So I had already shadowed an MSK radiologist, and I already visited the reading room, and so they kind of knew about me. But now it was time that this seed was planted. It was time for me to really kind of exploit it, milk it, grow it. And then the other things, because I'm not, I want to be honest with you, obviously I didn't know that I would match into radiology. So other things I did was I made connections in pathology, pediatrics, general surgery, and then of course, I ended up soaping in internal medicine. So if I had thought that that was the path that I was going to take, I could have just kept on. Now my application needed to be overhauled, completely, of course, because I'm pivoting from ortho, which is a surgical specialty, to radiology, which is, there's procedures and stuff, but it's not a surgical specialty. So of course I rewrote my personal statement and had radiologists look at it. And then the biggest deficit that I had known about in my application at the time was research. So at this point, I only have 3 or 4 months to get my name on some papers or some posters. And what I did was I emailed every single person and asked them for help. and ask them for ideas, ask them for projects. So this was every single place I had rotated at as a med student. The VA, the general hospital in the big city that I was in for med school, the cancer center, the outpatient clinics, and this wide spectrum I emailed, except for R1s. I didn't email R1s. I emailed every single chief, every single radiology fellow, every single attending, you name it. And I wrote, dear fresh attending, dear chair of the department, dear, whatever, dear MSK radiologist, I'm looking for this. I applied to Ortho and I didn't match, and I was able to, I'm so fortunate that I was able to rediscover my passion for radiology, or I stumbled upon radiology, and I'm so interested in like a project or a poster. There's this conference coming up, and I give them relevant information. Hey, there's this conference coming up. Here's a date. These are the topics that they take, and I'm doing a radiology rotation, and I have all summer off. Like I'm willing to work, and I was willing to work because I had already been burned by what I had told you guys before. Advice doesn't work unless you do. So I was able to get, in probably like 6 weeks, I was able to get 6 posters to Florida Radiological Society and go present them myself. And there, of course, there was networking opportunities galore. I was able to present a research project in person at the Western Neuroradiological Society, like in Arizona, super far from Florida. And I had to go and give like a like a 5-minute presentation in front of like a room full of like these big shots. I was super nervous, but I hid my nervousness, and on interview trail, like 3 or 4 attendings, like, oh, I saw you at this conference, like you presented, like good job. They don't know about the insecurities that I knew about, or the flaws that I knew about in my project or in my presentation. They just, they see your name up there, they see you trying. That's all you have to do. You're not expected to be the most competent researcher. You're not going to invent a new imaging modality, okay? You just need to put your best foot forward and just take one step at a time. So from that, I was also able to get a few like uploads to ACR Case in Point, which is line on my resume, and by the end of it, it all looked pretty good, and it was all true. So that was like a big confidence boost for me, because before I had felt like, oh, I can never do research, like I'm just not cut out for it, I'm not good enough, I'm not smart enough. But you don't have to be that smart, turns out. So when I say like I overhauled my application, the other thing, of course, I had to overhaul was like my application skills, my interview skills. So I did mock interviews for radiology with radiologists. Some of them proposed it to me. They said, oh, well, I don't have research for you, but maybe I can help you with the match process. So I welcomed that help gladly, of course, and I needed it. I applied to every single radiology residency except those that I knew 100% there's no way I'm going to get in. Harvard, Yale, Cornell, Stanford, I didn't apply to those. Anything else, even if it was like super prestigious, still applied. The other thing I did, which definitely helped me, was, I was always interested in imaging, MSK imaging, because of course I was interested in ortho. I loved going over X-rays, MRIs, CT scans with patients in clinic. I loved presenting my impression, on trauma conference when I would get called on. And so I developed I continued further to develop a sincere passion for radiology as much as I could, and really looked into why I could really fall in love with radiology. So at the beginning, when I was starting to prepare my application for radiology, at the end of March, April, May, definitely I didn't have the same passion that I have now. Now it's like super exciting to me. I'm like so glad this whole thing happened the way it did, etc. So I would really work on self-reflection as a re-applicant, specifically why you want to go to this next specialty if you're changing specialties, or why you're willing to go the extra mile, the extra year it could be, or the extra 2 years if you're doing a research year plus a prelim for the original specialty that you had applied to the first time. And so, I basically left no stone unturned. Like all the deficits that I had before, like I said, like people skills, interview skills, research, I fixed those. Last thing I did, which I didn't do the first time I applied, was I had my mentors reach out to me to programs for me at the end. Some of them said they'd call, so I gave them the phone numbers that I had available to me. This was like my letter writers did this for me. And then my PD at my current institution reached out for me also. I didn't know if she would because I started in October, but I asked. Worst case scenario, she would say no, but she didn't. And here I am matched. So I just hope that helps. Happy to chat about any topics. Happy to chat with you in person if you'd like. And good luck on the match.